Hi, today here we are with Junhyung Han, who is our UK medical school admissions mentor, here today to talk about the importance of hospital work experience, which obviously is a very important aspect of your medical school application. And let's start by having an introduction of Junhyung Han by himself.
Okay. Hello, my name is Junhyung Han. I'm currently working as a doctor in the Queen Elizabeth Hospital in Birmingham. I have graduated from the Birmingham University Medical School.
And sixth form in Birmingham as well.
Yes.
So Birmingham all your life in the UK.
Yep, so like total 7 to 8 years and just in Birmingham.
Big commitment. Let's start with sharing briefly about what experience you had in hospital back many years ago when you were a high schooler.
Yep. Back when I was a high schooler applying to the UK medical school, I had a work experience in like 3 different countries. So one was in South Korea, which is my home country, and one was in UK, where it was within the local hospital, and the last one was in Laos.
Laos is quite special. We'll talk about this in more details, but let's just make it clear that you had quite a lot of work experiences beyond the standard level, and you don't have to have this much to make application. Let's start with the essential question. We all know hospital work experience is beyond important. It's essential. If you don't have it, you shouldn't be making application to UK medical schools. So why is it so essential?
So as a student who's applying to a medical school, you should be able to demonstrate your passion and you're actually willing to make a dedication that you're gonna pursue a career as a doctor. And I think there is no any other better way to show that other than work experience, because it can show your communication skills, your compassion, your empathy, your resilience, and also with the clinical knowledge by shadowing the doctor. So I think that's why the work experience is so important in terms of application.
And let's define hospital work experience, the range, the scope of experiences you can get. So firstly, what types are there?
So if you largely divide the work experience, it can be divided into clinical work experience, which is when you shadow a doctor and you watch a clinical practice going on with the in-life patient interaction. And the other can be a non-clinical, so which happening in a non-clinical environment. It can be like a scientific lab or also like a volunteering activity by guiding the people around the hospital or the local community.
Oh, could it be like in elderly home?
Yeah.
Okay. I'm assuming clinical is the preferred option.
Yeah, it is. Definitely clinical is way much more preferred over the non-clinical. Not just because you can actually witness the patient-doctor interaction very frequently. You can also learn the different roles of the healthcare professionals within the healthcare, and you can also learn about the healthcare system as well. And just adding on to that, if you could learn like medical knowledge or like clinical skills by shadowing a doctor doing an operation or like major surgeries, it will be very valuable, and which can give you like a big bonus point compared to the other applicants.
Right. So just to summarize, I think mainly 2 points were made here. Clinical plus non-clinical is ideal.
Yep.
Clinical only is good.
Yep.
Non-clinical only is like not good.
Yeah.
Nothing is like you shouldn't apply.
Yeah.
Okay. And secondly, you mentioned how the hands-on shadowing of an actual surgery going on is like what people expect. If you go to hospital and you want to have hospital work experience, you want to look at how doctors are performing surgeries. But that's like the top tier hospital work experience you can get. But I'm assuming it's quite limited because hospitals shouldn't be opening their operational theaters to the public.
Yeah, so I definitely agree what Harry just said. And as a sixth form student without any medical degree or like any health certificate of your skills, it is you'll have a very limited opportunity to participate. And especially as an international student, you might not be able to have like a wonderful like clinical experience. So I do understand there's going to be limitations. So it is very important for you to do perform or as look out as much as you can as high school students. But even if you're not like involved in like very fancy major operation, some basic stuffs like measuring a blood pressure or measuring a temperature or respiratory rate, or having a short conversation with the patient and patient's family to help their emotional comfort, which can also develop your communication skills, which will be very important in terms of application.
Will the doctors get you to actively converse with the patient and patient families to comfort them?
Well, it depends on the patient's health condition or like what type of practice you are in. But even if you're not in the same consultation room, when you're waiting outside the consultation room with the patient, you can like actively engage in making a short conversation with them.
So as a shadower, you must actively, look for
seek the
opportunities
chance,
to, make conversations with patients.
Yeah.
Okay, it's not like doctor assigns you, right?
Yeah.
Speak to. Okay, I'm focusing on this in conversational interaction with patients because I heard developing the communication skills is a big asset admissions officers are looking for. Is there a value in watching a doctor consult and communicate with patients?
So by watching a doctor making a communication with the patient, you can like learn a lot of communication skills approach, and like for example, like when they're breaking a bad news, you can see like how they actually like open the statement and actually deliver the fact, and without hurting the patient's emotion. So you can learn that type of skills, and you can reflect on it and write it on your personal statement, or tell that experience during your medical school interview, which can show how you're into learning those type of essential skills. And also like expanding more on between the communication just between the doctor and patient, you'll be able to witness the communication between doctor, like colleagues and other healthcare professionals, and the communication with the doctor and the patient's family or relatives. So those kind of communication skills are very essential in terms of applying to the medical school.
Yeah, I heard that this communication skills is something that's very valued in UK. Probably even beyond like how good you are with your hands. Yeah. In terms of realistically looking at this, communication skills build up opportunity. Wouldn't the patients react sensitively to have a high schooler shadow the consultation?
Okay. So, yep, I do agree, and it depends on the type of the practice. Let's say if it's like a sexual health clinic or like a gynecological like examination, I don't think like most of the patient won't allow to have just a student in the consultation room. But if it's like just like a family medicine GP environment while they're dealing with the flu infection or like a minor osteoarthritis joint pain, so in that case, from my personal experience, they were like always more than happy to host the student there. So I think it depends on the practice and also the personality of the doctor as well.
Your experience in the UK, let's talk a little bit about that. Birmingham, so I'm assuming you attended the high school in Birmingham, so you had a work experience in Birmingham. Can you tell us about your Birmingham hospital work experience?
So I worked in a hospital called Birmingham Children's Hospital, which is one of the biggest pediatric hospitals in the whole West Midland. And I applied there through the application process on the website. I had to Google it, and they asked me to write a short personal statement, like why I want to do a work experience at this hospital. And I also had like a really short interview session about showing my dedication of becoming a doctor as well. And I was able to work there for 3 to 6 months during first half during my semester and last half during the vacation.
Wow, that's a lot of contents to process. So let's break it down to application first. So you had to write a personal statement, and you had to attach that into an application form within the Birmingham Hospital, Children's Hospital's own website.
Yep.
So that's like a mini UCAS.
I wouldn't say it's a mini UCAS because it's like it was a personal statement, but there was no like word limitation or like any specific.
How much did you?
I don't really remember, but I think it was something around 2,000 words. But yeah.
2,000 words. Okay,
Yeah.
but you mean 2,000 characters? Or
Not
2,000
words, I think.
But
I don't.
Isn't that longer than UCAS personal statement? Then?
Is it?
UCAS personal statement is 4,000 characters. So you have
Is
to
it?
write
Oh,
quite a lot.
yeah.
I'm assuming you wrote like to impress how you have aspiration to be a doctor. And
Yeah.
stuff. Yeah.
And also why this experience is really critical for me to apply into the medical schools as well. So
Interviews as well.
interviews and
Yeah, so it's basically mini UCAS medical school
you can say
application.
it that way. Yeah.
Okay. Okay. And I'm not going to ask what questions you were asked in the. Well, actually, I'm going to ask what question were you asked in the interview for hospital work experience?
So they just asked me like, why do you want to do this experience? Is there anything specific you would like to get from this experience? And also they just asked me about my previous work experience as well. So by the time when I applied, I think I've already been to the trip to Laos. So I tell them about that and they were really impressed with it. So.
Oh, so obviously, I'm assuming these work experiences are quite competitive, and you managed to get through that competitive process with the Laos experience. The Laos experience definitely helped. Was it with an actual real doctor, the interview?
I'm not
Or
really
staff?
sure. I think it was a staff member.
Okay.
Yeah.
Okay. And once you had this offer, you worked for 3 to 6 months. So that's vacation, summer vacation plus semester?
Yeah.
Okay. Okay, that's really good. Okay. So how often did you like work?
So it was a weekly thing. So every Monday and occasionally Friday as well. And I think I stayed there for like 3 to 4 hours per day when I visited the hospital.
Wow, wow, wow. That's good. That's good. And which department did you work in?
It was a pediatric short stay ward because I was a high school student back then. I didn't have like a clear idea of what's actually going on the ward. But thinking about it now, I think it was a short stay ward where like the child patient stays after operation until they stabilizes, or even before like where they wait before the operation. So I think it was short stay ward.
You made an application from Googling this opportunity. You started by Googling, and then you actually submitted an application form on a website. It's a very structured process for students in the UK to gain hospital work experiences. And I'm assuming it's because it's NHS government-run hospital system, which actively encourages high school students wanting to apply to medical schools to pre-gain experiences. And I guess that's the reason why it's essential, right? It's open to everyone. It's competitive, but it's open to everyone. So you should take a shot at gaining these hospital work experiences. Which nicely leads to the next topic. As an international student who's studying outside the UK and therefore do not have access to such systemized hospital work experience opportunities, how, as an international student outside the UK, should you obtain these hospital work experiences?
I do definitely agree with you. So as an international student, especially if the healthcare system in the country is more private based, the doctor might not be very open to host a student in their practice because it's their actual consultation room happening every day. So in that case, they might not have any structured application process at all, which might be really challenging for them to apply. So in that case, I would personally recommend you trying to seek help from your family member, friend, or relative who has a private clinic or knows someone, has a network to refer you to that type of practice. So like in saying other way around, so if it's a private practice, the doctor decides most of the things that's happening within the hospital, so they might be able to host you and have you there as a shadower.
Is that how you obtained your hospital work experience in South Korea?
Yes, that's how I did in South Korea.
Okay. Where did you work?
So it was like a local orthopedic clinic. So I worked shadowed there for like 3 to 4 hours for 6 weeks, I think. And it was someone that I know, so that was like how I was able to get a chance there. Wasn't through a structured process.
Okay. What if you don't have anyone who works in the medical field?
Okay.
What happens if you don't know anyone, if you don't have families?
So me personally, I also wanted to have some experience on other type of specialty as well. So there was like this very little practice that my dad usually goes to. So my dad personally asked the doctor, like, will you be able to like explain my situation, and will you be able to have my son as a shadower for a few weeks? And he luckily agreed and let me into the practice. So that's I gained like another work experience there. So you can like approach this way as well, but sometimes I do understand it can be really complicated and challenging.
Wait, so that orthopedic clinic wasn't a place your family member know, but
So there was like a 2 orthopedic practice that I went to. So
Okay.
one was like that and the other one.
okay, so you made your opportunity.
I tried to. Yeah.
Oh, that could be used quite tactically. You could
Yeah.
first approach a clinic as a patient, and then try
As
to-
a humble patient who doesn't know anything.
as a very nice patient, and earn the favor. What about Laos? Let's talk about Laos. What's this Laos hospital work experience about? Yeah.
So I'm a Christian and I go to a local church, which is quite big church, but they have had this annual program. They go to a missionary trip, medical missionary trip to a third world countries like Mongol, Cambodia, Laos, and like Vietnam. So they all already had like a really structured program every year. So I was able to apply there as a participant. It was a team composed with like a lot of specialist doctors, dentists, and nurses with high performance as well. So I was able to work there as a sort of translator.
Translator.
And also like moving the medical equipment and organizing the schedule of the day as well. So, I mean, obviously as a high school student, I wasn't able to do a lot of like clinical performance and like actually treating the patient, but still I was able to have gained a lot of communication experience or like witnessing the doctor doing the practice. So it was very, very valuable experience for me.
Well, it sounds very valuable to me. I mean, it's not just for, I think, medical school application purpose that this experience has value. I think whatever you decide to pursue, this must be quite a valuable experience.
Yeah.
Wait, so your church has this regular program. Not many church has this such program. It must be quite a big one.
It was a big church, yes.
Okay. Well, so you were quite lucky to happen to be attending this church.
Yeah.
Okay. So I think we've discussed enough to tell the prospective medical applicants about why hospital work experience is essential, what types of hospital work experiences you should pursue, even if you're an international student. To conclude, if you don't have any hospital work experience or clinical hospital work experience, you shouldn't apply to the UK medical school.
I mean, if you don't have any clinical experience at all, you could still try to seek as much chance from non-clinical experience as well. But however, as I'm aware, like the UK medical school appreciates the importance of the clinical experience very much.
Okay.
So there is a chance that it might not lead to a successful application.
Junhyung, you're putting this in very nice words, but we're basically saying that don't make application. It's waste your application. Okay. Now, let's assume that by September every year, just before you make your application on UCAS, you now have nice hospital work experience. How do you present these? Is there like a UCAS section where you fill out, this is where I did hospital work experience? How do you present your hospital work
There's
experience?
2 major channels you can actually show out and demonstrate your clinical experience. First one is, as you mentioned, the personal statement during the UCAS application.
Also, you talk about your hospital work experience within the personal
Within
statement.
the personal statement.
Okay.
You definitely have to put your experience within the personal statement.
Not elsewhere, like there's a section where you fill out.
Not that I'm aware of.
Okay.
Yeah, so it should be in the personal statement and not just stating a one single sentence saying I did this type of experience. You should be able to tell them your personal reflection out of that experience. And the reflection is very important in terms of writing a personal statement. And the second chance is during your medical school interview, either it's MMI or panel. You should be able to tell your experience and what you experienced, gave you any inspiration or reflection, and you should be able to tell them that directly.
I think the specifics of how you present your experience can be further talked in other episodes, like how to write personal statement for medical schools, how to prepare and conduct interviews for medical schools. But briefly mentioning, how do you actually write instead of saying, I did a hospital work experience in X hospital? How would you write,
Okay.
this is what I did?
So there's this like a framework that I used to apply, which is called a STAR approach. So S stands for situation, T for task, and A for achievements, and R for reflection or like future plans. So you just explain the situation, like which hospital I worked, how long I worked for, and task, what I was assigned to do, like my task, what I was supposed to do. And the achievements, it would be like, it doesn't have to be like any like quantitative value. Can be just like any like the compliments that you heard from your supervisor or from the patients or patient's family. And finally, the reflection is like what you actually learned from that experience. And then what can you apply these learning points for your future career and future practice. So this tool I've been using, and it has been very effective for me as well. So not just during my application to medical school, I'm still currently using the STAR approach, dealing with the patients at the hospital. So I think it is a very effective method to do so.
Okay, it's like a formula to presenting your work experience. And in interviews, do the interviews actively ask you, okay, tell me about this, tell me about that, of your work experience, or do you need to like tell the interviews in a nice structured way in like a model answer format?
Yeah. So I think it might vary between the format of MMI or panel. So in panel interviews, as they most of them correctly previously read your personal statement before the interview session, they might be actually like willing to ask you direct questions, as you mentioned. But if it's an MMI, because there's like a lot of students rotating around every 10 minutes, so you should be able to actively tell them what you learned. And you can also apply the STAR approach that I mentioned while answering the answer as well, to give a well-structured answer.
Okay, let's talk a bit more about, how to well present your experience. There is the formula, STAR formula. Apart from following this STAR formula guideline, is there one thing you shouldn't do, like a red flag?
Okay. So first of all, as most of the students might already be aware of, confidentiality is very important in terms of sharing this experience. If you accidentally leak a patient's name or like patient's information, like medical report, that's a big red flag. And also sometimes when students try to explain their previous experience, which can happen quite frequently as a student, so they might not try to use any strong words like saying bad things about your supervisor or the patients. So that's like another big red flag as well.
Oh, so you shouldn't like complain or negatively describe your...
So me personally, I have encountered some frustrated and angry patients, and I've learned a lot from the communication with them. So I was trying to explain that to during my mock MMI, but I accidentally ended up using quite strong words when describing this patient. So that's like a no point that you shouldn't do during your interview.
Okay, so that's like an easy pitfall you could fall to. I think this is going to be the last question of today's episode. So September, you've done your work experience, and you're sitting in front of your computer writing that paragraph about hospital work experience. And you're not convinced that this is wrong because you think the hospital work experience you've had is not great. Yeah. So it's not interesting. What are you going to say about that? What are you going to say to students who are worried that, okay, now it's September, I no longer have a second chance for hospital work experience. I'm not happy with what I've done, my achievements. What are you going to say?
So I think the thing that you should emphasize the most is the reflection. Like even the thing that you've done is not that fancy, or you haven't done any like very cool clinical surgery or like witnessed it. But even if it's just like a conversation between the everyday conversation between the patient and the patient's family, you could still learn quite a lot from them, and you can also show how your empathy and your compassion and how you actually do much care about the patient. So you should focus on your reflection, so rather than the clinical intervention that you've done. So that's a major big point. And you can definitely still talk about them because it's the experience that you've done. And even if it's not that fascinating in your perspective, because the examiners will also be aware of that you're just the high school students at the moment, and it might be very difficult for you to have those type of experience. So you should still talk about it.
Change the context slightly. Let's say in June, you have made all your applications, and you're left with one option. It's a very small private clinic. Like there are some tiers in hospitals, right?
Yeah.
So, it's like the lowest, smallest clinic.
Okay.
You should still go for it.
You should definitely go for it because, like, even though there's limitations, you should try to grasp as much as you can from the practice and from your experience. So you should definitely still go for it.
Okay. Right. I think what we have discussed today largely advises to prospective medical applicants, regardless of which environment you're in, look for whatever opportunity you can find. And it's not about how fancy that opportunity itself is, it's about what you make out of it. So thank you again very much, Junhyung.
Thanks so much for
sharing your experience, which is really interesting, and sharing your advice and tips.
Thank you so much.
Thank you very much. Goodbye.